Hello, more fully nourished community. This week's health topic is all about the nutrition-focused physical examination and possible etiologies. Most people don't associate the way that their skin looks with what they put in their mouths, nor do people understand the influence of nutrition on their oral health or how their nails are growing based on their nutrition deficiencies. So let's shed some light on this crucial topic so that you can understand the physical signs and symptoms to look out for and address your nutrient deficiencies before they become a serious problem that you endure for years to come, causing lifelong damage to the body and your overall health. So I'm going to break this down by system. I'm going to discuss the symptoms you may observe and inform you of the possible nutrition-related etiologies. So first, let's start with the whole body overall. Let's say you have unwanted weight loss or loss of muscle mass and skeletal muscle wasting. Now, I know that some of you may be thinking, gosh, I wish I could lose weight, and weight loss is my goal. But it's not everyone's goal. And for those who experience unwanted body wasting, usually have suboptimal energy intake and don't consume enough protein. They may also have severe malnutrition, especially if someone is trying to figure out their digestive issues and is on an elimination diet and doesn't have the proper support to make sure that their diet has variety. I see this all the time with clients that come to us asking for help with their digestive discomfort. Okay, let's talk a little bit about skin issues next. If you have excess fat stores or poor or delayed healing of wounds or pressure ulcers or drier scaly skin with fine lines and shedding, hyperpigmentation of skin exposed to sunlight, dermatitis, yellow pigmentation, or eczema, the list of nutrition-related etiologies for this is long. It could mean your food intake is excessive or you are deficient in protein, vitamin C, zinc, essential fat, vitamin A, niacin, tryptophan, iron, folic acid, vitamin B12, vitamin K, just to name a few. So clients who come to us with changes in their skin have imbalances due to decreased intake or absorption, increased requirement or needs, and then altered utilization or imbalanced intake of other nutrients. So functionally, these requirements are determined by digestion and absorption of food, immune balance, energy and mitochondrial requirements, detoxification, or biotransformation and transport and overall structure of the skin. The skin has its own unique endocrine and immune system, and it's the organ that's most distal to the heart. Its nutritional requirements are somewhat unique because of the rapid turnover and replacement of its protective layers. Usually with nutrition-associated changes, multiple systems are affected. So if you see something on your skin, please seek support from a functional dietitian or physician as soon as possible. Okay, now the next thing I want to talk about is nail health. If your nails are spoon-shaped, it can indicate iron deficiency and severe malnutrition. If your nails are dull or lackluster, it can be from protein deficiency or iron deficiency. If your nails are pale or marked with spots or smears, you may have poor blanching. So let's say blanching is when you push down your nail bed and it turns white. It is the time it takes for your nail to turn back to pink once the pressure is released. So if it's longer than 2 seconds, this can be indication that you're dehydrated or you have low blood pressure or you're deficient in vitamin A or C. If your nails also have a ridging, you can be deficient in protein. The nails can be used to really monitor toxicity. It can help evaluate nutrition status and give insight into systemic imbalances caused by disease. The diet and disease processes play a big role in the content, strength, shape, and surface of the nail growth. So growth of the hard, strong, and flexible nail plate requires adequate keratins and cysteine-rich high-sulfur proteins, and flexibility is influenced by and improved with increase in water content, so hydration is a big one. The nail is approximately 5% fat, mostly cholesterol, with essential fatty acids mainly affecting the processes at the outermost layer, and glycoproteins compose of the base of the nail. Minerals add strength and help with the normal formation of the nail, and vitamins and phytonutrients aid in the oxidative balance of the cuticle and the nail bed. All of these components are essential for fingernail and toenail health. Most nutritional deficiencies will present on the nail before they show up in the clinical or laboratory findings. Even in the case of autoimmune or systemic diseases, symptoms will often first show up as nail changes. Okay, next let's talk about the health of your head, your scalp and your hair, that is. A scalp that has soft spots like a baby is indicative of vitamin D deficiency. And very often we have clients that come to us expressing concern for their hair loss. It's a very noticeable sign that something is wrong internally. So when your hair lacks shine or luster or is thin or sparse, it can indicate that you have a protein deficiency and are deficient in zinc, biotin, and linoleic acid. If your hair is easily pluckable, it's also related to protein and biotin. If you can see a theme here, biotin and protein are big drivers for hair health. So now if you have corkscrew hairs, anywhere on your body which literally looks like hair that is bent or coiled, this is due to vitamin C or copper deficiency. And if you have premature whitening of your hair, it can indicate a selenium or a B12 deficiency. So it's clear that protein, biotin, vitamin C, copper, vitamin D, linoleic acid, and zinc are incredibly important for the health of your hair, follicles, and scalp. The next system I want to discuss is the face. So if your face is swollen or you have varied pigmentation across your face, it's a strong indication of protein deficiency. And your face is very pale, it can also mean that you have an iron, folic acid, or B12 deficiency. If you have a moon face due to the fat deposits on the side of the face, it's a strong indication again that you're deficient in protein. Or if you have temporal wasting on both sides of your head, it means that you need more protein in your diet and generally need more energy intake, so more calories. If you have a face with undifferentiated mucocutaneous borders, this is fancy terminology for the region of mucosa transitions from skin, for example, the lips, the nostril, the eyes, the urethra, vagina in females, foreskin in males, and anus, then your riboflavin levels are inadequate. Okay, what about your eyes? Another important area of the body and eyesight changes are often noticed before skin or nail issues. When we have pale conjunctiva, or it's the part of the eyelid that when you pull down your cheek, it's the underside of the rim. It is normal for the inner rim of the closest part of your eye to be lighter in color and the outer rim to be a little bit more pink or red. When the entire inner and outer portion is pale, it indicates your body is deficient in iron, folate, or B12. And if you have a very hard time seeing at night, it can be a form of vitamin A deficiency. So let's say your eyes are dry, grayish, yellow, or have a white foamy spots on the whites of your eyes. This is again a strong indication that you are vitamin A deficient. Same thing for dull or milky or opaque cornea or a softening of the cornea. If the corners of your eyes are cracked and reddened, it means your body needs riboflavin and or niacin. Most people know that vitamin A is significant when it comes to eye health, but do you know exactly what food sources to get the form of vitamin A that you need? This is where we really help our clients understand how to tackle their deficiencies head on from a food first approach. All right, let's talk a little bit about your mouth and oral health. There is a strong link between chronic oral inflammation and other health problems. Over 100 systemic diseases have oral manifestations, including cardiovascular disease, heart disease, stroke, respiratory infections, pancreatic cancer, diabetes, and nutritional problems. One of the goals of a functional medicine exam and nutrition evaluation is to screen for and identify recognizable patterns of the underlying causes of disease. So, a thorough oral examination can identify signs and symptoms of disease that point to clinical imbalances, which are often identified through a functional medicine matrix. The problem areas most commonly identified through the matrix include the processes of detoxification, elimination, immunomodulation, and energy regulation. So when a person has very red lips or bilateral cracks, we check for deficiencies of riboflavin, niacin, pyridoxine, and dehydration. Dehydration is really a big one that I see in my clients initially, and others who have a vertical crack in their lips or fissuring. This is a slit-like opening that could be from cold weather, but it also can indicate dehydration again or riboflavin and niacin deficiency. So if you have very inflamed lips or inflammation of the mouth, your protein, energy, and folic acid intake may be too low. Let's dive into the mouth now and talk about the tongue. If your tongue is purplish red in color or your tongue is inflamed, your body can be telling you that you need more vitamin B6, riboflavin, niacin, folate, and vitamin B12 or iron. If your tongue is smooth or slick and you've lost the papillae, which is the tiny raised bumps on the tongue that contain the taste buds, your body is trying to tell you that you need folate, niacin, riboflavin, iron, vitamin B12, or are malnourished in general. And if your taste is distorted or decreased, it often indicates a zinc deficiency and a lack in vitamin A. What if you have bleeding gums? This is seen in those who have a deficiency in vitamin C, riboflavin, folic acid, and B12 deficiency. Now, I could go on and on for an hour just about teeth health, but to highlight just a few of the important points, I'll just name a few things to look out for. If you're missing teeth or you have dental caries or loose teeth, it can be from excess sugar intake. But if your teeth are white or brownish and have patches, this can be caused from excess fluoride. And in many dental products or drinking water, fluoride is added, but long-term exposure to higher levels can cause a condition called skeletal fluorosis, in which fluoride builds up in the bones. So it is important to understand that your mouth contains an elimination system, which can be altered by oxidative stress, infection, and changes in the coenzyme requirements. This means that mercury amalgams or root canals, implants, periodontal disease, jaw osteonecrosis, nickel-based orthodontic appliances, mixed noble and base metal crowns, chrome, cobalt, partial dentures, BPA-based fillings, night guards, and dentures all can create oxidative stress in those who are susceptible. Now, this isn't even a complete list of all the physical signs and symptoms and nutritional deficiencies, but I bet you are going to look at every part of your body after listening to this video. And I don't blame you, because it's important not to ignore the physical signs that your body is trying to tell you. If you are concerned about your nutritional health after doing a personal assessment, please reach out to a functional dietitian or physician who can help you navigate through your deficiencies and get you living your best life, feeling fully energized, alert, and able to focus. As a functional dietitian, we at Move Fully Nourished can 100% help you navigate through this to help you reach your health goals. Head over to our website, movefullynourished.com, and click on Apply Now to learn about our one-on-one coaching programs and how we are different from other programs out there. Thanks for listening, and good luck with your physical examination.